Right this second, millions of people across the country have 5 specific medications sitting in their bathroom cabinets. These are not illicit substances or under-the-counter formulas, but rather legitimate prescriptions written by your physician, prepared by your local pharmacy, and taken diligently by many of you for years on end. I want to be completely honest with you about a reality that practically no health professional will discuss openly during a checkup. Once you cross the age of 60, these 5 specific drugs introduce hazards that are almost never mentioned when you receive the prescription, dangers that escalate silently as the months roll by, and side effects that can often be bypassed using highly affordable, targeted options. Please understand that this discussion is not an encouragement to abruptly quit your treatments without medical supervision. I am not making that claim at all, and I want that completely clear from the very beginning. This is strictly about the vital details that get omitted during your brief appointments. It concerns the biological processes your doctor lacked the time to outline and the nutritional deficiencies that no one ever cautioned you to watch out for. I am talking about the physical transformations occurring within your anatomy past 60 that cause a drug your physician studied decades ago to behave in a radically different manner inside your system today. The simple truth of the situation is quite straightforward. The standard medical protocols guiding these pharmaceutical choices were established using clinical trial groups that were much younger, predominantly male, and not dealing with multiple chronic illnesses at the same time. A 65-year-old body is fundamentally different from the physiological models utilized in those early drug trials. Your organs process active compounds at a much slower rate. It burns through essential vitamins and minerals far more rapidly, and it possesses a much smaller safety buffer when complications arise. Personally, I would avoid taking any of the 5 medications we are about to review if I were over 60. This is not because they lack therapeutic utility, but because each one triggers a specific biological reaction that turns much more hazardous as you age. Each has a safer substitute that targets the identical underlying issue, and each requires an honest discussion that you have likely never had with your physician. If you find this helpful, make sure to subscribe to the channel and give this video a thumbs up. We are currently working hard to reach 100,000 subscribers, and every new member of our community helps ensure that other people searching for these insights can actually discover them. The initial medication on our list is over-the-counter calcium supplements. I am not referring to the naturally occurring calcium found in sardines, yogurt, or dark leafy greens. I am specifically talking about the heavy tablets, chews, and 600 milligram pills that have been heavily promoted to women over 50 for 30 years as a way to preserve skeletal strength. Let us look at the underlying science that went unmentioned when you were first advised to take them. When you consume calcium through whole foods, it enters your digestive tract alongside a complex network of synergistic elements like vitamin K2, magnesium, and essential minerals that guide the mineral directly into your skeletal system and keep it out of your cardiovascular plumbing. The natural structures in real food handle this directional routing without any extra help. A synthetic calcium pill is completely unable to do this. It simply dumps a massive isolated payload of the mineral into your blood vessels without any directional guidance whatsoever. Extensive scientific literature, including a massive analysis of nearly 24,000 individuals published in the British Medical Journal, reveals that taking isolated calcium is linked to a heightened chance of arterial hardening and major heart issues, especially for seniors. You can picture supplemental calcium as a shipping vehicle operating without a delivery address. It enters your bloodstream, and in the absence of vitamin K2 to serve as a navigator, it simply unloads its cargo onto the closest accessible surface, which happens to be the walls of your arteries. As the years pass, this mineral buildup leads to stiffened blood vessels, high blood pressure, and a serious spike in cardiovascular vulnerability. The tragic paradox is that the very supplement meant to reinforce your skeletal frame might be silently petrifying your circulatory system instead. My preferred alternative is to obtain your daily mineral intake entirely from dietary sources. A 3-ounce serving of bone-in sardines offers more than 300 milligrams of the mineral along with its natural helpers, and you can also rely on whole milk yogurt, steamed kale, and sesame seeds. Should your doctor determine that pills are absolutely vital, they must always be combined with 100 to 200 micrograms of vitamin K2 in its MK7 form to turn on the proteins that guide the mineral into your skeletal system and away from your blood vessels. You must also include magnesium to manage the mineral's behavior at the cellular scale, meaning you should never take it in isolation because the biological map is just as critical as the cargo. The second medication we need to talk about might be sitting on your kitchen counter this very moment. These are proton pump inhibitors such as omeprazole, pantoprazole, or esomeprazole, which frequently go by brand names like Prilosec, Protonix, or Nexium. These drugs function by shutting down the microscopic mechanisms in your digestive tract that generate stomach acid. While they excel at cooling the intense burn of chronic indigestion and were engineered for brief spans of 8 to 12 weeks, somewhere along the line, those temporary prescriptions turned into permanent habits. Studies repeatedly demonstrate that a massive percentage of patients taking these medications have used them for multiple years without any clinical review to see if they still need them. Let us examine the internal consequences of relying on these drugs over the long haul. Despite the discomfort of indigestion, your gastric juices are not actually the bad guy. Strong stomach acid is the precise tool your digestive system uses to cleave vitamin B12 from the food you eat. It is how you successfully assimilate iron into your system. It is the catalyst required to make zinc bioavailable to your cells. It serves as your primary immunological barrier against harmful microbes that make their way into your mouth. When you completely neutralize this protective barrier for months or years, these essential biological functions degrade silently without showing any immediate warning signs. Data published in the Journal of the American Medical Association reveals that prolonged use of these acid blockers is heavily linked to severe vitamin B12 depletion. To make matters worse, a lack of B12 in older adults causes far more than simple exhaustion. It triggers neurological issues like tingling extremities, poor physical coordination, trouble recalling words, and mental cloudiness, all of which are routinely mistaken for typical aging or the onset of cognitive decline. A very specific biological reality makes this situation highly dangerous for seniors. Your stomach naturally produces less digestive acid as you grow older. An individual at 70 years old already has a much lower acid baseline than they did at 40. When you introduce a potent acid blocker to an already diminished system, you force your digestion into an unnatural state that it cannot successfully maintain. The resulting nutritional deficits slowly gather momentum and worsen with every single month that passes. For moderate cases of acid reflux, my suggestion is to look at the actual source of the problem, which is rarely an overabundance of acid. Instead, it usually stems from a malfunction of the lower esophageal sphincter, the muscular barrier meant to keep stomach contents from splashing upward. The primary culprits are lifestyle factors you can easily adjust, such as eating heavy dinners, reclining too soon after eating, drinking alcohol or fizzy beverages, and experiencing upward pressure from a sluggish, backed-up digestive tract. If you correct these specific habits, you will find that the reflux often disappears entirely without any chemical assistance. For individuals who still need some digestive comfort, deglycyrrhizated licorice, often called DGL, can coat and protect the esophagus while encouraging tissue healing without turning off your natural acid production. If you are currently taking an acid blocker, please do not stop using it cold turkey. Your body can experience a massive surge in rebound acid production that is highly uncomfortable and can last for several weeks. Speak with your physician about designing a gradual, monitored reduction plan. During your next routine blood work, make sure to ask for checks on your B12 and magnesium levels. These two essential nutrients are typically the first to plummet when using acid blockers long-term, yet doctors rarely think to test them. The third class of medication we must examine is statins. I want to be incredibly clear here because there are crucial distinctions to make when discussing these cholesterol drugs. For patients who have survived a cardiovascular emergency like a heart attack, a stroke, or a stent insertion, the scientific data backing statin therapy is highly robust, and I am not disputing those benefits. However, for the millions of seniors put on these drugs simply due to high lab numbers without any history of heart issues, the balance of risk and reward after age 60 is far more complex than most doctors acknowledge. Here is the biochemical reality that is rarely brought up during your appointments. Statins achieve their effect by blocking an enzyme in your liver known as HMG-CoA reductase. While this enzyme is responsible for synthesizing cholesterol, it is also the very pathway your body uses to manufacture coenzyme Q10. Consequently, anyone taking a statin is also inadvertently shutting down their own internal production of this vital molecule. This compound is far from an optional health supplement. It is the essential spark plug located inside the mitochondria of all your cells that drives the generation of cellular energy. Your cardiac tissue, which works harder than any other muscle by beating over 100,000 times daily, relies on this compound more than almost any other organ. The consequences of depriving your body of this coenzyme are quite noticeable. It typically manifests as deep muscle soreness, chronic exhaustion, and an inability to exercise, which are frequent complaints among patients that get brushed off as simple signs of aging. Once you pass 60, your cellular powerhouses are already beginning to decline in efficiency naturally. Drug-induced nutrient depletion speeds up this cellular decline at the exact moment in your life when your body has the lowest capacity to handle it. If you must remain on a statin, my advice is to take 100 to 200 milligrams of CoQ10 daily in its highly absorbable ubiquinol form alongside a meal containing healthy fats, since the compound requires lipids to be processed by your gut. Doing this will not interfere with how your medication works. It merely replenishes a critical nutrient that the drug actively steals from your system, and you should also ask your physician a key question that is rarely raised during routine follow-ups. You should ask if your 10-year cardiovascular risk score has been updated recently, as that probability shifts over time and the math that originally justified putting you on the drug might look completely different today. Before moving on to the fourth drug, we must stop and establish a very firm boundary. There are distinct medical scenarios where none of the alternatives mentioned in this discussion can replace expert clinical care. If you are managing serious conditions like heart failure, chronic kidney dysfunction, epilepsy, or active cancer therapies, please do not alter your medication plan because of something you saw online. The complexities of those health challenges demand direct supervision from your medical team, with no exceptions. The guidelines we are exploring here are intended for generally healthy seniors who are dealing with typical age-related issues. If you are unsure whether you fit into this category, your prescribing doctor is the best person to consult. The fourth medication involves the chronic use of non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, or high-dose aspirin for ongoing discomfort. Because you can purchase these pain relievers over the counter, it creates a false sense of security that is not backed up by the actual science. By the time you reach 60, your kidneys have naturally lost a significant portion of their filtering power. Clinical studies show that your glomerular filtration rate, which is the gold standard for measuring kidney health, drops by roughly 1% annually after you turn 40. This natural decline means your renal system has a much smaller safety margin when stressed. Common pain relievers work in a way that constricts the blood vessels feeding your kidneys. While a younger adult has plenty of kidney function to spare during this temporary constriction, it is a very different story for seniors. For someone whose organs are already functioning at a lower level, taking these pills regularly can speed up kidney damage without showing any outward warning signs until major harm has occurred. There are absolutely no physical symptoms during the initial phases of renal decline. The process occurs in total silence, and the earliest indicator is typically a blood test that was never requested because no one thought to check. The second biological hazard is that the protective mucosal barrier of your digestive tract naturally thins and becomes more fragile as you age. These pain medications function by suppressing prostaglandins, which are the precise compounds responsible for rebuilding and protecting that stomach lining. Using these drugs even a couple of times a week is linked to a massive increase in the likelihood of internal stomach bleeding for seniors. Emergency room visits for severe gastrointestinal hemorrhaging among older adults taking common pain relievers is a well-known, highly preventable tragedy. Silencing your body's pain warnings while leaving the underlying joint inflammation completely unchecked is like disabling your home's fire alarm and trying to sleep through a blaze. If you are dealing with joint pain, my recommendation is to treat the source, which usually involves localized irritation and joint wear that oral pills only hide rather than heal. Applying a topical diclofenac gel directly to the sore area can deliver significant localized relief while keeping the drug out of your digestive tract and kidneys. Taking 2 to 3 grams of high-quality fish oil daily can cool the overall inflammatory processes that cause joint stiffness from the inside out. Furthermore, optimizing your magnesium levels, which are deficient in most seniors, helps naturally modulate the pain pathways in your body. These alternative strategies are highly effective therapeutic options. They work by correcting the actual biological issues rather than simply masking your body's alarms. The fifth and final medication is the most sensitive to discuss because it involves a habit many people feel they absolutely cannot live without. I am referring to prescription sleep aids, including benzodiazepines like Xanax or Valium, alongside newer formulas like Zolpidem, which is widely known as Ambien. The American Geriatric Society list of potentially harmful drugs for seniors highlights these specific medications as highly inappropriate for older patients. These sedatives are highlighted not because they fail to put you to sleep, but because their compounding side effects for seniors far outweigh any temporary benefits. Let us explore the neurological impact of these sleep aids. These drugs work by artificially boosting GABA, which is the primary calming chemical in your nervous system. They render you unconscious quite effectively. They trick your mind into believing you have experienced a restful night. However, they completely disrupt the natural structure of healthy restorative sleep. The vital slow-wave deep sleep stage, which is when your brain activates its natural waste clearance system to wash away the toxic proteins linked to cognitive decline, is severely blunted by these sedatives. You are essentially knocked out rather than rested. You open your eyes feeling groggy and sluggish. Crucially, the essential brain-cleaning cycle that can only occur during deep slumber is entirely bypassed. Long-term studies published in the British Medical Journal tracking thousands of seniors established a clear, independent connection between regular use of these sedatives and a heightened risk of developing cognitive decline. This is by no means an isolated scientific observation. It has been confirmed by numerous research teams studying different patient groups across the globe over more than 10 years of monitoring. The second major hazard is well known to ER doctors, yet it is rarely discussed by the clinics that write the prescriptions. These sedatives severely compromise your balance, reflexes, and physical stability. Because accidental falls are the #1 cause of injury-related fatalities for seniors, taking a pill that leaves you unsteady on your feet when waking up in the middle of the night represents a massive documented danger to your life. The issue does not lie in a lack of scientific data. The true failure is in not communicating these clear dangers to the patients themselves. My recommendation is to identify and treat the underlying causes of your poor sleep. For most older adults, sleep issues are caused by reduced melatonin due to late-night screen use, high stress hormones at bedtime, hidden breathing issues, or fluid pooling in the legs that shifts back into your bloodstream and forces midnight bathroom trips. Every single one of these issues can be resolved using targeted non-drug protocols. To naturally support your sleep hormones, try mixing 2 tablespoons of tart cherry juice concentrate into warm water an hour and a half before you turn in. These cherries are packed with natural building blocks for sleep and have been shown to help people fall asleep faster and stay asleep longer. Taking 300 to 400 milligrams of magnesium glycinate an hour before bed can soothe your nervous system naturally without harming your deep sleep cycles. You can also employ a simple patterned breathing exercise. Inhaling for 4 seconds, holding for 7, and exhaling fully for 8 will stimulate your vagus nerve and rapidly lower your body's stress hormones. Make it a habit to perform 4 repetitions of this cycle every night before closing your eyes. If you are presently taking a prescription sedative, please do not attempt to quit suddenly. Stopping these chemical sleep aids requires a slow, carefully monitored tapering process. Quitting cold turkey can trigger severe withdrawal symptoms and health risks. What I am suggesting is that you initiate an open, educated discussion with your physician to evaluate if these pills are still genuinely serving you, and to see if a managed transition to safer alternatives makes sense for your health. Take the case of a patient we will call Harold, a 69-year-old retired electrician who is highly practical and not one to make a fuss. He arrived at his health assessment with a list of 4 different prescriptions he had taken for a very long time. His daily list included a cholesterol blocker, an acid reducer, a synthetic calcium tablet, and a prescription sleep aid. He sought help because he felt completely drained of energy every single day. His muscles were constantly sore, and he found himself struggling to recall common words, which was starting to happen often enough to worry him deeply. His routine annual blood panels had all come back completely normal. Everything was labeled as perfect, with stable cholesterol and zero immediate red flags on paper. Yet, when a practitioner finally ordered specialized tests to check his B12, magnesium, coenzyme levels, and insulin, the actual reality was highly concerning. His actual vitamin B12 levels were dangerously low. His blood magnesium levels were resting right at the bottom edge of acceptable limits. This was not a magical cure, but rather a straightforward case of identifying a biological problem and fixing it. Here are the main lessons I want you to take with you today. First, if you use a calcium supplement, confirm that it is formulated with both magnesium and vitamin K2 in its MK7 form. Without these critical elements, the mineral lacks any biological guidance and has no safe way to reach your bones. Second, if you have taken an acid blocker for over 3 months, request your physician run tests on your B12 and magnesium levels during your next checkup. Inquire directly about a structured step-down plan and how you can address the real underlying causes of your indigestion. Third, if you take a cholesterol medication, supplement with 100 to 200 milligrams of ubiquinol daily alongside some dietary fat. Be sure to ask your doctor if they have updated your heart health risk calculations since you first started the therapy. Fourth, if you use common pain relievers on a regular basis, request that your doctor evaluate your kidney health with an up-to-date filtration test. Ask if you can switch to topical pain creams instead. Absorbing active pain medications throughout your entire system is usually completely unnecessary for treating localized joint pain. Fifth, if you rely on a prescription sleeping pill, start a dialogue with your physician about safely tapering off the drug. Ahead of that medical discussion, try using magnesium glycinate and tart cherry juice for 2 weeks, and keep an honest record of your sleep quality. Finally, you must actively request specific lab tests by name, including vitamin B12, serum magnesium, coenzyme levels if you take a statin, fasting insulin, vitamin D, and ferritin. These essential metrics show what is truly happening inside your biochemistry, and they will almost never show up on your routine blood work unless you explicitly ask for them. Your biology past the age of 60 reacts entirely differently to medications than it did when you were 40. Prescriptions written based on older biological baselines must be reconsidered as your body's capabilities transition. Having your treatment plan reviewed is your fundamental right as a healthcare consumer. Taking charge of your health starts with understanding the exact questions to bring to your doctor. Before we conclude, I would love to hear from everyone who is tuned in today. Please share your current age in the comment section below. I make it a point to read through every comment, and the age mix of our community directly guides the health topics we will explore in upcoming videos. If most of our viewers are 65, the next discussion will look very different than if the majority are in their 70s. Additionally, let me know your location by sharing your city, state, or country in the comments. Drop those details down below. These insights are reaching far more people than I ever imagined, and tracking our reach helps me pinpoint who needs this critical knowledge the most. If you have a loved one currently taking any of these 5 drugs without knowing how they affect their biology, please share this video with them. They absolutely have a right to understand what is happening inside their bodies. It is highly unlikely they are hearing these essential facts from their primary care providers. The most hazardous wellness recommendations are those that seem perfectly logical until you look at what they are physically doing to your internal systems. Make sure to hit the subscribe button right now. Please give this video a like as well. We are marching steadily toward our goal of 100,000 subscribers, and every single person who climbs aboard increases the chances that someone else searching for answers will find this vital information.